Welcome to the educational series by Prospera Global on medical second opinion driving clinical accuracy and cost optimization. Question 3. You have discussed, and what you have raised is about the CABG, that the patient actually did not require that and could be managed conservatively. So just tell us, how did the patient found it? He would be definitely very happy that he has not been taken up for this high-care surgery.
Yes, you would be. Yes, even we were quite surprised, Dr. Geeta, because we were almost going to approve the case, but then of course it was subject to a second opinion, and the patient was also compliant to our need. And the doctor, in fact, he was from home country itself. So the doctor opined on seeing it that, like what I said, he did a repeat angiogram, and the repeat angiogram, he found that the lumen of the RCA lumen was not very much narrowed. Okay. The diameter of the RCA was not very much narrowed, number one. And secondly, he had comorbidities. So a high risk of comorbidities, including pulmonary edema, was diagnosed. So these comorbidities made him a high risk for taking up for a CABG surgery. All right. And thirdly, those conditions, the other vessels were not formidable for taking up for a graft procedure. So these conditions, when coming from a second medical opinion doctor, convince the patient as well. Of course, any patient would try to avoid a surgery, they would be happy. So this patient continued on medical management. So because the patient was continuing to be insured with us, he did continue with medical management because he was a 60-year-old patient. So he was continuing on medical management and improvement and just treatment for his comorbidities.
We hope this insightful session has enhanced your understanding of medical second opinions and addressed any doubts you may have had. Thank you for being part of our Medical Second Opinion educational series. If you found this helpful, please like, share, and subscribe.